Dr. Van Merkle, thank you for being here. The floor is yours.
Thank you very much. Thank you, and thank you, Dr. Lacey. It's phenomenal what you've done over the years, Dr. Lacey, and I'm happy to be a small part of it. I feel like we've got maybe a little way overstated on my part that we're going to be able to cover chelation, hormones, and thyroid in just 1 hour. And I actually did a hormone a couple of days ago in Atlanta on chelation, hormones, and thyroid, and it took well over 12 hours. So we're going to get some highlights here, some main things to get you going, start on chelation. And I'm going to present this and more information. Maybe I haven't talked to Dr. Lacey about this, maybe get 2 or 3, 4 hours that I can do at that lecture. We can really get in some good advanced training on chelation. I apologize. You'll see my sign is backward in the thing. I forgot to get it switched around when I sat down on the video camera, but it is science-based nutrition. I am the developer of science-based nutrition, and I've been putting on lectures for a long time. And I've been doing more chelation, oral chelation, than probably any chiropractor ever. And I've taught hundreds of doctors to do oral chelation. And we have a lot of phenomenal cases. And we're going to get to some of them here. I've got way much more material than I need, but let's just go in and get started here and see if I can't get things going. I want to back up just a little bit here with what we're doing with nutrition and vitamins. And in 2021, right here, $58 billion was spent on vitamins. $58 billion spent on vitamin sales in 2021. It's probably more than that now. But look, the ACA and the ACA report just a few months ago reported that $193 million spent on chiropractic, according to the ACA. So which piece of pie do you want to work for? The 193 million or the 58 billion? By the way, this 58 billion is 100% cash. Not waiting for workman's comp, PI, insurance, those kind of things, although those are okay to go for. There's a much larger practice, a lot more potential in this nutritional arena that I'm talking about. Currently, more than 4 in 5 adults are taking vitamins. 80% of everybody you see is taking vitamins. And but only a quarter, only 1 out of 4 people taking vitamins know why they're taking them. They're not getting objective testing. And this is one of the things I really like about Dr. Lacey's group is that it's about science, it's about testing, it's about knowing what you're doing. And that's exactly what oral chelation is about. It's about testing properly in the labs that we do as science-based nutrition. So we are basing our recommendations on science and we get objective results. Or you could do the joint. You get 4 visits for $45. So where do most people get their recommendations for vitamins? Well, going to find out that half the people who take vitamins listen to their doctor, listen to their physician. So are you making recommendations based on labs, on objective results, or objective findings? If you are, you're probably going to get a good result or get good compliance. And that's what you got to have. You got to have people a reason to take the vitamins, and then with objective testing, you're going to have compliance because they get to see what's going on. And now there's some reasons why the Florida Chiropractic Physician Association is so very important, because dynamic chiropractic showed 23.8% of medical physicians intend to leave their practice in 2 years. MedPage, November 26, 2022. 155,000 physicians will quit in the next 2 years. 155,000 physicians. Wow. You know, it's about 15 to 20% of all physicians, medical doctors are going to be quitting. Wow, that's huge. And just a few weeks ago, 75% of healthcare workers will leave the profession by 2025. Do you know that 60% of all nurses right now are 60 years of age? They're going to be retiring out. And so we're going to have a huge shortage of healthcare workers, nurses, but also physicians. 139 are going to leave by 2033. This type of work that we're doing as chiropractors is going to be critical. In fact, I believe it's critical now if you know how to talk to patients, present it, and that kind of thing. So now let's get into why you need to be doing oral chelation. Now, I'm not going to read through all of these because we're just going to spend all the time reading about these things. But why do you need to be doing oral chelation? And also, along with the oral chelation, you got to do hair. You got to tie these things in together. Do you realize that the FDA has no standards for heavy metals in foods beyond arsenic and infant rice cereal? Heavy metals in baby food. They eat more relative to their body weight, and so they get exposed to more and they absorb more than adults do. These heavy metals affect brain development. They're linked to ailments including lung disease, kidney disease, skin lesions, cancer, and I mean, look at all things. Arsenic, cadmium, mercury. There's just so many heavy metals in our foods, and you can read through these notes and get more details. Arsenic in groundwater exists at high levels in the US, China, and India. And the US has led the world in the use of arsenic for agriculture and industry. And insecticides with lead and arsenic were banned in the 1980s, but arsenic is still used as rat poison, and it is still in our orchards. One of the ways that they kept bugs down years ago was arsenic. And so arsenic doesn't just evaporate away, and that's a problem. So rice plants have exposure to arsenic. Now, this is important right here. Certain species of bacteria can tolerate high levels of arsenic, lead, mercury, and cadmium. And there's, just a little note here. There's no genetically modified rice in commercial production in the United States today, just a few weeks ago. And heavy metals in baby food. Sellers merge grains from multiple truckloads from different farms, making low arsenic rice difficult to trace. Inorganic arsenic levels were 20 to 93% higher in the finished product compared to the ingredients. You get high levels of arsenic in additives like vitamin mixes and spices as the cause of the spike pre and post manufacturing. So it's what we flavor it with that causes the arsenic to go up even higher. Heavy metals in baby food. It talks about limiting parts per billion. And the FDA has recommended organic arsenic levels at 100 parts per billion. But look, if we get it down to 50, and the actually, if you limit down to 50 parts per billion, you'd reduce cancer by 79%, almost 80%. And Baby Food Safety Act was pushing toward 10 parts per billion, but our government is looking at 100 parts per billion. Look, just so much in this slide. One of the important things is baby food manufacturers hold a special position in public trust. Consumers believe that they would not sell unsafe products. Consumers also believe the federal government would not knowingly permit the sale of unsafe baby food. That's wrong. And despite evidence of arsenic in infant rice cereal above 100 parts per billion, there was no FDA recall. And so this is something you got to be looking at children. I know if it's affecting children, it'll be if everybody needs tested for this. But how important is it that children get tested today? Every child needs to get tested. And the FDA has no standard for heavy metals in foods beyond the action of arsenic. So why are we worried about heavy metals? Because they knock out heavy metals for a reason. They knock out your good nutrient elements. And we're going to have lists of that. These non-essential metals can mimic essential elements, causing disruption in cellular and enzymatic mechanisms. Cadmium replaces zinc, knocks it out. Thallium replaces potassium. Arsenic replaces phosphorus. Uranium displaces iodine. And we go on and on. Mercury displaces so many different things. Like arsenic does more than just displace phosphates. It's going to also affect calcium and other things. If I get some cases, I'll show you that. And Hair analysis will give us exposure to chronic heavy metals over possibly a longer period of time. And so I'm not going to get into all the details of hair testing. But as far as clinical signs of toxicity, acute and chronic signs can be different. More on where you're getting your arsenic and lead in your fruit juice. And how many of our kids drink fruit juice? 21% of the 45 juices had concerning levels of cadmium, arsenic, and lead. This is amazing. Grape juice and juice blends that highest average heavy metals, and organic juices did not have lower levels of heavy metals than conventional ones. Then they just kind of blow your mind, because you would think, no, they'd be healthier. But as far as heavy metals, it's not. As for lead, we know how bad lead is. 50 parts per billion. The standard for lead in bottled water is 10 times lower at 5 parts per billion. Whatever the source, plants take up the heavy metals from contaminated soil and water, and it's in there. It's in the plants. Arsenic-containing chemicals are historically used in orchard fruit trees in the United States. And arsenic, there's the source for that, can stay in the soil for very, very long periods of time. And organic means you haven't used any pesticides for what, a period of 4 years. Pesticides or herbicides. So it's very important that you try to avoid eating the peel. But look at this, composting your beets, turnips, carrots, radishes, and potato skins just puts your arsenic back in the soil. And juices you mix from concentrate could have higher arsenic if made with arsenic-containing water. And we all know about mercury in food. So orange roughy, marlin, king mackerel, swordfish have high mercury. I'm showing you why you need to do oral chelation. And everybody listening today, I challenge you to get an oral chelation challenge hair test. At least that, start with yourself, and I guarantee you're going to be amazed at what you're going to find. You might be thinking you're pristine and you eat organic and all that. And that's fine, but we just saw it organic may not do a thing for you, and you'll be amazed at what your body does. Now, we're going to get into some things here about that. How about this? Consuming large quantities of dairy could lead to an excess exposure above safe limits. The higher you go in the food chain, you get toxins in plants. Animals eat the plants. Fish eat the plants. The heavy metals, these toxins, become concentrated as you go up the food chain, unfortunately. So that does not mean I'm going to give up my fish and my steak. I'm going to tell you what I'm doing here in just a little bit to mitigate my exposure and my risk from heavy metals. And so here it is, bioaccumulate. It accumulates in living organs at a higher rate than is removed from the body. And same with us. We're going to find, when we do a testing, if I get to the cases, I'm looking at the clock up there. I'm thinking how many cases we're going to get to where you'll see that the body is not getting rid of these heavy metals. So hair analysis, I'm going to skip through hair analysis. Hopefully you guys have been exposed to that. Here's a case I want to share with you. A lady presents with cancer. And this is way back in 2007. She's still a patient today. She's still alive and well. She was diagnosed with stage 4 metastatic breast cancer with a spot on her liver lung about the size of a quarter. And she came to me for a second opinion before biopsy, chemo, radiation, before anything medical was done. We saw her cancer marker was 185. Now this cancer marker was CA2729. It should be less than 38. Hers was 185. After being on my special diet and vitamin protocol, her cancer marker dropped to 140, dropped 45 points before anything medical was done. By 1 month, it had dropped in half. By 3 months, it's down to 35 without any medication, chemo, radiation, or hormone therapy. Now, again, she is fine today. I don't have the most recent results here, but she's alive and well today. Basically, she had a lumpectomy back in 2007. After she's on our program, about a month, she had a lumpectomy, and 3 out of 3 lymph nodes were positive. Now, 3 out of 3 lymph nodes are positive. What does that tell you about the cancer? It's already spread. Because of that, you can read here, the radiation is, which I was pretty sure it would be, if the CA 2729 is 185, you got stage 4 cancer. And that CA 2729 is the most common tumor marker for breast cancer in women. Every female you know ought to be getting that test done. Everyone. Medically, it's going to run about $380, and you'll find that, well, through SBN, you can get that for about $40. $40. You think every woman you know would want to spend $40 now where they are with breast cancer? Absolutely. But 3 out of 3 of those are positive. Radiation is immediately recommended daily for 6 weeks, followed with chemo, and told they should probably have 8 to 10 years to live, which oncologists thought was pretty good. This lady is 48 years of age, trim, thin, looks awesome. Exercises vegan, eats organic, takes vitamins, does everything right you can possibly imagine, and she looks awesome, truly. And now he said, you got stage 4 breast cancer. If you do, we want you to do all the chemo radiation. If you do everything we want you to do, you got 8 to 10 years to live. Well, what's the oncologist saying? Based on our experience, everything we've done, everything we've read, all of our oncology centers, if you follow our advice, in 8 to 10 years, you will be dead. Now, at 48, I made sign up for that, which is why she was seeing me. And now, first of all, I never told her not to do chemo radiation. I said, you live and die by this number. And as the number came down, doctors, if you had a patient at 185 and you put them on a diet and vitamins and cancer marker dropped 45 points in 2 weeks, what would you tell a patient? Give me another 2 weeks. And all these 16, whatever, it's 223 now. In all these 16 years, I've never told her not to do chemo and radiation. Told you live and die by that number. If you follow my program, the number stays down, you will be fine. But if you get off the program and then that number starts to go up, it's a sign your cancer is getting worse. Now, I'm going to skip through a lot of details on this because I want to show you a critical point on this. Now, here's the blood work. If you're not familiar with science-based nutrition, I color-coded the labs. So blue down here at the bottom means code blue, means it's very high or very low. It's very bad. Red is danger and yellow is warning. And these warning things are very important. Although her lab is not bad, nothing major, shows cholesterol 238, not a big deal, especially with the cholesterol of 102. She's mildly low thyroid. She's mildly anemic. Low white count, a little bit low, and there's a cancer marker 185. But the question really is why? Okay, if you're doing everything right we can possibly imagine, diet, vitamins, exercise, you're trim, you don't smoke, you don't drink, you're doing everything right, the question to ask is, how did you get cancer? Well, using the same pattern, this is the hair test from doctor's data incorporated into our science-based analysis system, puts everything in red, yellow, and blue. We see that she has extreme high levels of aluminum and extreme high levels of cadmium. Okay, that's that. Now, we did oral chelation on her. Clear back in 2007, we had her do a challenge. And on the challenge, all you have the patient do is collect 6 hours of urine. Just collect 6 hours of urine whenever. And when she collected that 6 hours of urine, this is what showed up. High levels of aluminum, which correlates with what we're seeing in the hair. So her body's being exposed to aluminum, and her body's getting rid of it 2 ways, through the hair and through the urine. Good, okay? Now we see high cadmium here, but it's not showing up in the urine, just a regular urine, but it is going in the hair. But then look when we use a little bit of DMSA. DMSA is a chelating agent that is the most effective that we're going to use. We use a little 1,000 milligrams for the challenge, which means wakes up in the morning, she urinates, then takes the DMSA all at one time, drinks water, a lot of water, and then it collects the next 6 hours of urine. That's essentially a urine challenge. I'll go a little more detail of that here in just a little bit. And what we did when we saw that is we see lead at 62, which is one of the highest levels of lead we have ever seen in anybody. And we also see high levels of mercury. But notice that the lead and mercury isn't coming out the urine, and it is not coming out the hair. This is the critical aspect of chelation and why people have heavy metals. They're exposed to it. You do a simple hair test and the lead and mercury don't show up. You do a little urine test, it doesn't show up because this patient has a genetic and inherent inability to efficiently eliminate lead and mercury. So here's what I believe happened. This 40-year-old lady over the years had been getting lead and mercury higher and higher, and it allowed her immune system to get out of control. Her immune system was over challenged, distracted by the heavy metals, lead and mercury, and let the cancer get out of control. Because if I'd have only focused on the lead, on her cancer, but not dealt with the lead and mercury, would we have gotten anywhere long term? We wouldn't have. And this is why you got to be thinking, we have cancer every day. We have cancer every day. So why do you have cancer now? This is what's going to make you a better doctor, by doing hair testing and oral chelation on everybody, because some people have an inability to efficiently eliminate heavy metals. And so they, just like I mentioned a few slides ago, they bioaccumulate. Their body's being exposed to it faster than they can get rid of it. And they're just not getting rid of it fast enough. And that is why we have the ability with these labs to do these tests. We can get the products to do these oral chelation. Now, there is IV chelation. I can't do IV chelation in Ohio. And so I only teach those things that I can do in my state. So I don't think chiropractors anywhere can do IV chelation. I think IV is limited to vitamin therapy only, not IV, EDTA, DMPS, DMSA. So as a chiropractor, I'm teaching what I can do in Ohio, oral chelation. And I will tell you, oral chelation, in my opinion, works every bit as good as IV chelation. Takes a little bit longer, but I'm in no hurry. Because this lady is, we're going to put her on a protocol, which we did to get the lead and mercury down, to get the burden off her body. But now she's going to need this the rest of her life, which is why she's still a patient today. She still gets this test done at least once a year, if not twice a year, depending on the numbers. But she's getting this testing done on a regular basis because her body didn't get rid of it. And you're going to find that people have these things where you're chasing cancer. You might be chasing all these other symptoms and you're missing the cause of the problem. And so hopefully this is a great example. I have hundreds of other similar cases like that, where it seems like the obvious thing is that they've got allergies or they got this or that. And really the underlying thing might very well be they got heavy metals. So let's go to the normal guy. This is Herbert. He's 63, 5'6", 175. His medical doctor said, "Oh, you're just getting older." He's got complaints of high blood pressure, high cholesterol, upset stomach, anemia, ED, mild fatigue, headaches. He's on an aspirin, a statin, and lisinopril. That, everybody, is 40% of the adult population. Everybody coming to your practice, all your adults, 40% is this guy. They're on those drugs. So if I made him come see me, so he came in, and here's the hair test we did. Now, the heavy metals don't look bad, except he's got high uranium. You can see the high uranium. I'm pointing to it. You can't see me pointing. I got high uranium right here, okay? And his cadmium and lead are just a little high, just a little elevated, but nothing else. We go down here, we see extreme high levels of copper. Okay, everybody, what's the disease of high copper called? Wilson's. Yes, Wilson's. And can Wilson's disease cause all of his symptoms? Yeah, it can. So where is he likely getting his copper, everybody? Water pipes. More than likely, water pipes. So testing his water would be a good idea. Testing water coming into the house, testing water coming out of the faucet he drinks, even if it's RO, I don't care what kind of special water filtration system you've got, test the water you're drinking. Okay, so what does he need? He probably needs a water filter. Can you guys help with that? Easy. Okay, let's look at a blood test. Way down here, we see he's extremely low in vitamin D. Huh. Can low vitamin D cause all of his symptoms? A low vitamin D cause this? Yeah, it can. $40 a year will give him 5,000 NS units a day of vitamin D. That was easy. Moving on up, he's got high ferritin, he's got hemochromatosis. Hemochromatosis cause all these problems? Yeah. So what does he need to do? He needs to donate a pint of blood. You've helped him 80% right there. A water filter for the copper, vitamin D, and donate a pint of blood. His liver enzymes are elevated, I believe, because of the medications he's on. We did oral chelation on him. Nothing shows up when he collected just 6 hours of urine. Nothing. We had a little DMSA, high levels of lead and mercury. That's not coming out the urine, and it is not coming out the hair. His body has a natural inability to get rid of lead and mercury. And lead and mercury gets higher in the body. Higher levels of lead and mercury cause high blood pressure, high cholesterol, upset stomach, anemia, ED, mouth fatigue, and headaches. Yeah, it can. So what does he need? He needs to be on oral chelation, a little DMSA, the rest of his life. Can you do that? It's easy. And when you do testing properly, like I teach, you're going to find that most of your cases, it's easy. Aha, there it is. High copper, water filter, low vitamin D, easy. Donate a pint of blood and oral chelation. Okay, moving on. Okay, so we're going to get through. I don't have time to go over all this. I'm already halfway through this. I want to get through with hair testing. There's things about washing hair, unwashing hair. I don't have time to go over that. I want to get right into oral chelation. Here's lead. And we got a 12-year-old boy with ADD, ADHD, a skin rash over his whole body. And that rash would clear after he stopped doing 5 or 6 cans of soda, all the aluminum. Any aluminum's too much. And we know aluminum displaces magnesium, calcium, zinc, and phosphorus. I think a lot of us aren't getting as much aluminum. The cans we're doing, we've kind of reduced that. I think we've been a little more open and aware of aluminum, how bad it is. Fluoridation, fluoride, your fluoride toothpaste, things increase absorption of aluminum. Antimony. Now, there's a lot of heavy metals we can go through. And I don't have time to go through every slide here, but understand that all these heavy metals are significant in our environment, and they cause a lot of symptoms and nebulous symptoms. Symptoms you'd never think, like arsenic can cause abdominal pain, nausea, vomiting, hematuria, jaundice. They can affect the myocardium. EPA standards are varied. But here, arsenic can cause epigastric pain, epistaxis, cardiomyopathy, malaise. How many of your patients have malaise, muscle weakness, eczema, dermatitis? They just don't feel good. Oh, and I'm going to blast functional medicine right now. Oh, they got low adrenals, and they've got low neurotransmitters and amino acid, and they're dysbiosis. You think arsenic can cause dysbiosis? You think mercury and lead and all these things are going to cause dysbiosis and low adrenals and low amino acids and fatty acids? Yeah, and you can treat all those functional things forever, chasing symptoms. The patient never gets better. Look at all things associated with it. Now, if you were doing functional medicine, what would you think? Yeah. And so anyway, arsenic associated with child mental development. So arsenic water and cancer, arsenic contamination in drinking water can lead to certain cancers. And where are we getting arsenic? Okay, well, here's a boy, severe abdominal pain and rectal bleeding. He had Crohn's disease. And at age 20 had his colon removed. Now, before he had his colon removed, his grandmother came into me just desperate to see what we could do to help her son, who by the time his grandmother talked to me, he was in the hospital. And those are labs, but basically the grandmother went in and cut the boy's hair, and we got it sent off, and we see extreme high levels of arsenic. Now be aware, remember how I said arsenic causes abdominal pain? The higher the level of arsenic, the levels of arsenic toxicity are exactly the same as ulcerative colitis. Same, ulcerative colitis. And Crohn's, ulcerative colitis, symptoms are the same as arsenic toxicity. Well, The grandmother couldn't get the parents or the medical doctor to even look at this test to see the extreme high levels of arsenic. They're more interested in taking the kid's colon out. How sad is that? Oh, I believe this 100% revert, that we could have saved that kid's colon, saved his life. But medical doctors and the parents were too influenced by the medical doctors to look at the actual facts of this. So anyway, now you can see where the arsenic is in these things, going through. Oh, be aware when you have drought, arsenic levels go up. When you have drought in an area, arsenic levels go up. And that's what's been shown to affect the health of the human across all kinds of, across their lifespan. Arsenic, hypertension, diabetes, and cancer. Even very low, 5 parts per million of arsenic is linked with high rates of skin lesions and other problems. So many cases come to mind right now I could share with you about arsenic toxicity and skin lesions and ulcers, even in little kids. And medical doctors call it psoriasis. And even wells, if you got a well you think it's good, wells show elevated levels of heavy metals, arsenic, uranium, tungsten, manganese, which occur naturally in the soil. And so again, if there's one thing, hopefully I can teach you oral chelation. One of the best things you can do to help reduce arsenic and lighter heavy metals is install reverse osmosis for your drinking water. The other things we talk about, whole house water filtration systems, but for drinking water, definitely RO is what you need to do. Barium. Side effects of that, again, brilliant. Don't have time to go over this. I want to hopefully try and get to some oral chelation here. Cadmium, very bad effects of cadmium. And I want to get to give you a little bit of information on oral chelation here. Cancer and cadmium, a lot of cancer and cadmium, pancreatic cancer and cadmium. What? Yeah, cadmium, pancreatic cancer. You'd be amazed how many cancers that we're fighting on a regular basis associated with heavy metals. Hopefully in your brain now, it's reverberating in your brain about how many of your patients that have cancer, maybe breast cancer, have lead and mercury going on. And you're having frustration because you're throwing more and more stuff at it and they're not getting better. Maybe because you need to do this. And I'm glad you guys are listening today. I've got more training, and maybe with Dr. Lacey, we can do more along this line. Cadmium acts as steroidal estrogen in breast cancer cells, so it's going to make that worse. Renal cancer, cadmium, prostate cancer. There we go. Mental retardation. If you just read the headlines on these, pretty amazing. All this stuff that's in our environment, so common. And if you remember, Rochelle later with breast cancer, I showed you had high levels of cadmium in the hair, high aluminum, high cadmium in the hair, but no lead or mercury. And calcium, chromium, side effects, cobalt. I want to get to, okay, copper, you kind of know that's Wilson's disease, kind of covered that a little bit. Again, this, I usually take this presentation going over about a 2 or 3 hour period. Copper toxicity is usually due to water supplies most often, or hair dyes and things like that could be a source of copper exposure too. And you might get it in water pools, like swimming pools, etc. Elevated estrogen levels increase serum copper. Now, if you got high hair copper, could be used for oral contraceptives. I'm trying to get to the additional testing you would do if you have high serum copper. If you have high hair copper, you always run a high serum copper and a serum in the blood, serum copper, and and you're going to run a ceruloplasmin, ceruloplasmin, which is synonymous. Ceruloplasmin to copper is like ferritin to iron. And so you want to test that, see if there's a genetic factor type of thing. Now, a little tip on how to get rid of copper. An easy way to get rid of copper is to dump blood. I started doing that years ago. I started using there's some drugs that medical doctors use to get the copper down. I find use an RO system and donate a pint of blood. It's a good way to get rid of iron and copper. So just a little practical tip there on how to do it with our limitations as a chiropractor. We got to be creative. So dump a pint of blood, and you're going to put them on some vitamins, zinc, molybdenum, manganese, going to be very helpful. So anyway, schizophrenia, have high levels of copper and iron, copper elimination. Quickest way to reduce serum copper is phlebotomy. Okay, that's my opinion. I've not read anybody else doing that, but for my patient that's got high copper, we dump a pint of blood and copper goes down nicely. Serum copper, ceruloplasmin go down, etc. So I've got things in here that you can use for resources. So when you see high copper, is going to show you resources and maybe vitamins you're going to help to eliminate it. My SBN report kind of does this automatically, brings all this information here together. But this talks about ceruloplasmin. I was just talking about germanium. You never use germanium as a nutrient unless it's very low in the hair. Sometimes used with cancer treatment, but don't overdose, don't over-treat with it. And once you've got optimal levels of germanium, don't recommend more than that. Like I said, I only recommend if it's very low. Iodine deficiency, I'm going to zip right through. Okay, lead, we know how bad lead is. There's some case I want to get to. Okay, here's a fellow with lead. I don't remember the details to that, but I guess I can back that one up. Okay, Anthony, 68 years of age, at extremely high levels of lead. And even though it looks like it's super high, like it never improved, notice that this was 39 units of lead coming out. And then it dropped 6 months later down to 21. So we got half of it out in just that short period of time. This exposure to heavy metals does not happen quick. And sometimes you don't want it to go quick. You just want to look at take the long view of it. You didn't develop this overnight. It's in your body, it's in your tissues. We're going to get rid of it. And then you're going to be on chelation the rest of your life. And I'm going to talk about some things that I do because of my genetic inheritance regarding heavy metals. Lead and gasoline, we see reduced lead and gasoline, lead in our bodies drop, behavior, lead and behavior, lithium. Okay, again, this is going to be in the notes, and I anticipate doing more lecturing and take my time on this. I wanted to get down to here. Environmental toxins, more molybdenum. Okay, this is a good case right here. We had almost a mistake on my part, but we had a 14-year-old girl come in, and on each hand, there was 100 warts about the size of an eraser. And now I was treating her mom for a back problem, and the daughter came in, and her mother wanted me to look at her hands. I looked at her hands, and I said, wow, that's really bad. And how long have you had them? She said, oh, they've been coming on for 6 months. And you see where a dermatologist tried to burn some of these warts off, but 100 warts on each hand. Well, I asked the girl, how long have you had your braces on? She said for 15 months. I said, when your braces come off, the warts will go away. It's just one of those things I just said. I don't know why I said it. 2 weeks later, the mother comes out, get adjusted again, and brings her daughter along and said, look at her hands. The warts were all gone, 100% gone, except the scars where the doctor tried to burn them off. I said, what'd you do? She said, we went back and took the braces off. I said, I didn't tell you to take the braces off. She said, well, the warts were causing so much trouble, we took the braces off. Now, why do I think the warts and braces? Nickel is very toxic and creates a lot of skin lesions kind of thing. And I had a little boy with warts on his feet. Same thing, the nickel from the braces they had on. So anyway, it's well known to be nephrotoxic. It caught, look at all symptoms, dermatitis, skin problems, that kind of thing, eczema. So anyway, platinum, I'm almost through all these heavy metals now. And selenium, colloidal silver, never use colloidal silver for internal. If you want to use it for a scrape burn, that's fine, but don't take it internally. Sulfur, some very important things about sulfur. I don't have time to go over now, and my time is fleeting. I want to get to some details on. Okay. Okay. How do we do it? How do we do oral chelation? Okay, first time you test a patient, you need a pre and post. Now, this is something that's very important. You always have to do a pre-test. Some people I've trained, they think, well, why go through the expense of a pre-test? It's about $100 because you've got to know if your DMSA, if your chelating agent, whatever you use, is working. So you just don't, well, I'm just going to do DMSA on everybody. You've got to have that pre-challenge to show the patient how important the DMSA and your treatment is. You won't know if you don't test, if you don't test properly. So you've got to have that pre-test is critical. The pre-test is 6-hour urine with no provoking agent. The post-test is a 6-hour urine collection after you take the DMSA. So we always do take DMSA first thing in the morning. So you wake up. Now the pre-test you can do anytime. But then the post DMSA, you get up, you wake up, urinate, then you take all of your full dose of DMSA all at once. Now I've got the protocols and dosages here, all at once. And then you collect the next 6 hours of urine. So drink plenty of water to get that through your system. Now, some things very important about DMSA. Do not take DMSA even when you're in treatment after 3 o'clock in the afternoon. I don't take mine after noon, after 12 o'clock noon. A little example, a patient noticed he was feeling so much better on DMSA. He was on our treatment protocol, where we only had him take it once in the morning and once at noon. He decided to take it 4 times a day at double the dose. Well, if a little bit's good, a lot's better. He came in 2 days later and said, man, Dr. Merkle, I'm having a lot of blood in the urine when I wake up in the morning. A blood in the urine? When are you taking DMSA? Well, I thought I'd just take it, 4 times a day rather than just twice a day and increase the dose I want to get that lead and mercury out of my system faster. Well, the problem is the DMSA has about a 6-hour half-life. So when you take DMSA at 8 o'clock in the morning, it's still coming out at 2 o'clock in the afternoon. If you take DMSA at 3 o'clock in the afternoon, it's still coming out at 9 o'clock, maybe even a little bit later even. You don't want to be laying in bed, sleeping with a load of arsenic, lead, mercury, other toxins sitting in your bladder. It will cause bleeding. So once I smack him around a little bit, instead, no, you follow our program with DMSA, and he went and had great results like that. But very important. Can you have problems from DMSA? Yeah, you can. And I need to talk a little bit about DMSA used to be sold by many vitamin companies in the US. They've all quit selling it. They've all quit manufacturing and selling it. Do I have time to tell you why? The FDA basically, I'm just going to explain. I've got the slides. The FDA basically contacted Thorne, who used to make DMSA, and said, we've had complaints of people having upset stomach, indigestion, and a skin rash taking DMSA. They didn't say how many, but Thorne, instead of fighting it, they said, well, they just gave up because can you fight the FDA? They got unlimited resources, and DMSA is not a big seller. I mean, they're not making a lot of money off DMSA anyway. And so do you think Thorne or any of these other companies wanted to fight the FDA $500,000 or $1 million to keep making DMSA when you're not making that much money anyway, and you can never win. Well, Thorne contacted me and the other doctors using DMSA, and I tried to say, I called them and said, well, how many people do you talk about? They said, they don't know. You can't tell. It could have been one. And it's probably somebody in the medical community didn't want the competition. They don't want the competition. It's all about territory. And so because of that, it scared everybody in the United States from manufacturing DMSA. It is still available in Canada, from Canada, South Africa, and Europe. We don't use a product from Canada. I think it's an inferior product, but the product from South Africa is phenomenal. That's one we use the most. It takes a week or two to get it by order, but it is a great product. And we've tested them. One of the things we do, and I don't have time to show you all my testing, but we actually test these oral chelation products to make sure that they are getting a provocative release of heavy metals from when we do it. So anyway, you're going to need 2 test kits, the pre and the post in the beginning. And the cost, there's some pricing there for the urinary challenge. And this is how we set it up for our patient. You got a pre-kit and a post-kit. And then that's what the kit looks like. Basically, you pee in the cup, pour it into here, or, okay, guys, we just pee right into here, right? And after you've done it for 6 hours, collected 6 hours, whether it's a pre or post, you keep this container. And once you're done with it, once you've done your full 6 hours, then you're going to, it's going to say this in this form. You're going to shake that up. You're going to shake it up for about 30 seconds, make sure everything is well shook up. And then you're going to pour a portion of that into here, into this little test tube. You're going to fill it up to here. And that is what you're going to mail in, just this little bit right here. Not the whole thing, not this cup, just a little bit right there is all you're going to do for the pre and the post. And then you dump that down the toilet. And I don't know, do you keep these, recycle them? I don't know. Doctor's data sends new ones out in the kit. So anyway, you check their weight. Now this is the way I was trained to do it. And these are the doses that were sent out that I used initially no, actually that is my protocol. This is the new urinary guidelines. The protocol that I got from doctor's data and other resources for my weight, I'm 200 pounds. I would use 2,800 milligrams of DMSA for my challenge. Well, 30 years ago, when I first started doing this, I was using the accepted protocols, and I had patients that got upset stomach and they'd get skin rash and they'd feel bad. And so I modified the doses. I modified the challenge dose and a treatment dose so that my patient don't have symptoms. They get great results. I put my results against anybody's any day, but they don't have side effects and symptoms. And so this protocol here is what we use in our clinic. This is our challenge dose. What we do to provoke provocative, urinate, take all these at once. And the tablets we have are 100 milligram tablets. So yeah, at 200 pounds, I would take 2,000 milligrams, which is 20 pills all at once. Yeah, you got to drink a lot of water for that. You want to drink a lot of water to get that through. Now, how did that happen? Okay. Well, I apologize for that. Where artificial coloring? Oh, here's where you're stuck on. Okay. Let me delete that one. Oh, then let's go to this slide. Can you see this slide? Okay, screen sharing. Let's share it. And can you see that one?
Yes.
Okay, sorry about that. So anyway, just to quickly go back a little bit. This is what the box looks like. And then this is the container that you pee in here or pee in there, and then you shake that up and put it in here up to this level, and that's all you send in. You're going to do that for the pre and the post. And so the weight This is the guidelines that I put together years ago, so our patients don't have problems. So if you got a patient that's 140 pounds, you're gonna give them 13 or 14 pills to take all at once. And then the daily therapeutic dose for 3 days, 600 milligrams at a time. Again, this is not the regular protocol that that was standard for oral chelation, but I'm not having any side effects. And Thorne got knocked out by somebody challenged. The FDA said they got complaints. We've not had any complaints. In fact, we've been collecting testimonies from our patients on how effective DMSA is. And that's what we need you to do too, because the FDA ever comes back to us again, if we just quit using DMSA, we will lose the ability to use DMSA. But if we have doctors out there using it and they chart how they're doing, they get comments back from patients, you're going to get great results and you're going to have a good resource too. Okay. Now I know I've went longer, and if you I need to get this down. Okay. All right. The first question from Dr. Misit, how to figure out how to evaluate if someone needs chelation therapy. Let's see. The simple answer is, do you live on planet Earth? We live in the most toxic environment the world has ever seen. There is no pristine, there is absolutely no area in the world that is not contaminated. And you need to test people in your area, and you're going to find, oh, over here, you got arsenic. In Dayton, Ohio, over here, if you live over here, you got uranium. If you're over here, you got mercury. In fact, I challenge everybody listening to get yourself tested. Get a hair test. And I use Doctor's Data. They're the biggest. I believe they're the best company that's available. Get your hair test, do an oral chelation challenge, collect 6 hours, and then find get your DMSA. We don't sell DMSA to our patients. We tell them, go online, order it from a South African company. It's going to take a couple of days to get in. And that is how my patients get DMSA. I don't want FDA snooping around my office thinking they're going to find DMSA, because we don't carry it. But they get it that way. I guide them with on how to take it, but I'm not selling it. And so it's up to them. Send hair somewhere, Doctor's Data. And I recommend everybody, all you doctors, get tested, because once you get yourself tested and you test a few of your favorite people, some people with some very chronic problems, you're going to be amazed. I have never regretted doing oral chelation. Dr. Lacey, you had a comment?
Okay, I was just wondering if you could just put on your screen the address or phone numbers of where you buy the hair kits.
Oh, the hair kits is Doctor's Data. Doctor's Data out of Chicago. Now, just a little tip, Science-Based Nutrition, we're like a co-op, and because we do so much business with Doctor's Data, we get pricing for hair kits and other things cheaper than anywhere. You can't get anything cheaper than our co-op discount pricing through Science-Based Nutrition. But if you just Google Doctor's Data, you'll be able to bring all that up and get there. I think the hair test may run you, over $100 or something like that, and we get for substantially less. But there you go. Let me see if I can find some more questions here.
So nothing we should get through you then.
Oh, actually, yeah. When you're a member, when you're an SBN member, you work with SBN, you get all your testing through us, because you'll get cheaper pricing. And a benefit of get the testing through us, Science-Based Nutrition is electronically connected to Doctor's Data, LabCorp, and Quest. So the test results go directly into the system and make those beautiful color-coded reports and integrate it with the blood work. And so the findings in the blood work may affect the blood test and vice versa. And so when you use Science-Based Nutrition and get your testing through us, you're going to get a nice report rather than have to do data entry. If you order your own through Doctor's Data, you'll have, if you want to use our SBN reporting system, you have to do data entry. And who wants to do data entry?
So you can send me that information. We can send it out on our emails for the people that just that are interested. And We'll
Yes.
do that as a public service.
Yeah, yep, we can do that. Thanks, Dr. Lacey. Let's see. Well, a cheap water filter, such as Brita, be sufficient to rid metals and toxins. Okay, that's a great question. You guys remember PFAS, perfluorocarbons, these firefighting chemicals and things like that? Okay, it's part of this lecture that I've done. I don't have time now. And the only water filtration system that gets out these forever chemicals, PFAS, things like that, is RO. It's just the RO is the only way to get those out. So don't buy cheap water. The Brita and all these other faucet ones and things like that, you've got to get a good quality RO system, especially with the heavy metals we got today in our environment. Don't go chintzy on your water. And I don't care if you get a nice one at the office, fill up your safe water containers and take it home and drink, but you should not be drinking tap water at all. So great question. Well, lab used for mineral and heavy metal testing, doctor's data. Tests. Oh, somebody was testing it. Okay. I am Dr. Van Merkle with Science-Based Nutrition. And our goal or mission is to help you be healthier and provide discount testing and also discount testing guidelines, and it's a patented report that will help make your life much easier. So I know it's after 7. Rod's going to have this information up, and we will do more training with you, and look forward to seeing you at another lecture, at the FCPA lecture in February that Dr. Lacey is doing. I'm going to be there, provide more information on this, some hands-on work, show you how to get this done so you can really help your patient with that. So Dr. Lacey, I'll turn this back to you, but thank you for this information.
Thank you for being here and spending your time with us. Very good information. Thank you.
You're welcome.